Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again, here with part of our patient education series for you. Remember that these visits are not intended to replace, or these videos are not intended to replace visits with your physician. If you have concerns, please make an appointment to be seen. We'll be happy to see you here in our office, same day if need be, area code 775-359-7111. Today we're going to talk about the pink eye. Now, pink eyes can actually be very confusing and complicated, and specifically, we don't want to talk about the pink eye of the newborn or child in the first month or two of life. That's a very complicated issue and sort of its own thing. If your child has a pink eye under 2 months of life, you need to be seen, or a red eye, you need to be seen, and you need to be seen quickly. Please make an appointment to see your physician. For children who are more than 2 or 3 months of age, the most common cause of pink eyes living here in the desert is actually allergies. In the wintertime, it's viruses, and they're hands down responsible for the majority of things we see. If your child has eye with eye goo that you're wiping out less than 3 or 4 times a day, we really don't worry about it. That's either allergic or it's viral. If it's allergic, we'll treat it with allergy medicines. If it's viral, it needs to run its course. If your child has a red eye with or without eye goo that's associated with changes in vision or with headache, that is not pink eye or conjunctivitis. That needs to be seen immediately. The list of things that can cause that is huge, but if you have headache or vision changes, you need to be seen immediately for that. If you have pink eye with goo that lasts for more than, or that has to be wiped out more than 3 or 4 times a day, regardless of the color of the discharge, whether it's green, yellow, white, clear, that suggests perhaps this is a bacterial infection. Now, having said that, the majority of bacterial infections in the eye do get better on their own within 48 hours with no therapy. Having said that, most physicians, myself included, will treat these with antibiotics. Now, one thing that complicates this a little, about 1 out of 10 kids who have bacterial conjunctivitis, or pink eye as the schools refer to it, also have middle ear infections. They may or may not have earaches to go with it. That's why in my office we insist on seeing you. We want to rule out some of the other causes of the pink eye, including middle ear infections and including some other unpleasant but very unusual disorders that include but are not limited to increased pressure in the eye or glaucoma. So to that end, we don't call in antibiotics over the phone, not even drops. It's not in your child's best interest. If you had glaucoma and we missed it, your child would be left blind in that eye. So why does the school district make the big deal out of the pink eye and they act like this is the plague? I don't know. They always have. Nobody goes blind from typical bacterial conjunctivitis. It almost always goes away on its own, and if we need to treat it with drops, we can treat it with drops. If you have a middle ear infection, we need to put you on oral antibiotics, which is why we want to see you ahead of time to help distinguish between the two. Remember, however, you should not have headache or vision changes with this. If this is happening, we need to see you right away. If you have questions or concerns, please make an appointment to be seen with your regular doctor, or you can call us at 775-359-7111. I hope that you find this video to be of value, and we'll see you next time.